Well, hello there. I'm Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. And as always, I apologize for the lousy name that I use for my podcast, but we've been doing these podcasts now for a couple of years, so I really can't change it. So, what are we going to talk about today? We're going to talk about a program called the 6-week knee reset. Okay, the 6-week knee reset. If anybody wants more information, you send me a text or an email, and we'll send you a copy of the program because it's pretty exciting to me. Is because people who don't want to have knee replacement or knee surgery, or if they've already had those done, they're not happy. We have a really good system to help you get back to living the life you should be living. But let's go over knee issues today. And what I want to talk about today is why chronic knee pain is often not just a knee problem, okay? Listen, like all human beings, if that tooth hurts, you think that's the problem. I understand it. But a lot of times you have to look on a more global scale or more motor unit scale, like someone comes in with a bad low back and they've got knee problems or ankle problems. Is the ankle or the knee causing the back and vice versa? So just look at a motor unit. So to look at the problem of knee pain with a little bit more of a global perspective. So let's go over the four degeneration causes occurs in 4 stages, okay? Number 1 is intermittent pain. Yeah, we all have that. Primarily occurs when activity is minor cartilage damage and early joint space narrowing begin. It's just a little creak in the knee. Think about it. It's what you see typically when you're in your 30s and you go from being very active to all of a sudden you start thinking, maybe I take up softball or get away from the more active sports like running. But that's stage 1. We call it intermittent pain. Once again, it occurs with activity and there's minor cartilage damage and early joint space narrowing starts here. Now let's go to stage 2, constant discomfort. In this case here, the pain becomes more throughout the day. As this happens, inflammation rises and cartilage breakdown accelerates. So please understand, constant discomfort is not just pain, okay? Not just pain. You have to understand that there's going to be inflammation. I'm going to touch on the inflammation things. It also can make a knee problem a little bit worse and how it causes the cartilage in the knee to break down a little bit quicker. Let's move on to stage 3, intensified pain. Pain significantly worsens as it begins affecting daily activities as substantial cartilage loss and bone changes develop. Okay, so stage 3 is like the pain's getting it starts to affect daily living more than it should. Okay, and this is when maybe take some leave, you little ice, after paddleball or pickleball these days, tennis match, or you go for a run, you have to ice it. It feels okay, but it's not getting any better, and you're not getting any younger. So age doesn't help either in the case of, when you're going through these different stages of knee degeneration. Now, stage 4, loss of function. This is when you have severe functional limitation, and it goes on with bone-on-bone contact. And this is when making a knee replacement is a consideration. Can you put it off? Can you curtail your activities? It's loss of function. And loss of function is something that I probably wouldn't take on in the 6-week knee reset program. You're just too far gone, so why bother? All right, so let's go over it. 25% of people over age 55 suffer from knee pain. Knee pain is one of the most common musculoskeletal complaints. Pain is the result of multiple contributors, okay? Think about all the stuff going on. It could be muscles, imbalanced muscles, an old sprain that didn't get healed, causing your muscles to work harder. We'll go over several of the muscles a little bit later on in today's podcast. And the thing here is most doctors focus on the knee itself, which is understandable. I mean, hey, that's where the pain works. That's where people are going to be happy. Okay, I take this pill. Or you go for the gel shots, these wonderful gel shots that, for the most part, do not work. If you get 2 or 3 months out of it, you probably do about as best you can possibly do. But that's how you focus on just the knee. Okay, you do a little physical therapy. ice, rest, Advil, Aleve, all the other good stuff that goes with it. But that's, again, one of the things I see is the doctors focus on just the knee itself, and that's perhaps where we differentiate ourselves here at Core Health. And with the 6 weeks knee reset, you're going to be focused on a lot of other things. Why don't we start going over it? Commonly overlooked contributors to chronic knee pain. Pain is a signal and may not be the root cause. Successful care looks beyond just the knee joints. Okay, and that's going to become, it's like an anathema to people. Like, wait a second, but my knee hurts. Yeah, I understand that, but let's go a little deeper and find out why. Number one area overlooked is the lumbar spine. The lumbar spine plays a major role in knee function. It's the nerves go to the nerves from your lower back go to your knees. It goes to the front, goes to the back. So just understand the lumbar spine, your lower back, plays a major role in knee function. Spinal stress can change how the knee moves and loads. More loading issues, more degeneration, or more accelerated degeneration of the cartilage. So lumbar nerves influence knee strength, stability, and coordination. So the levels in the spine that are linked to the knees. You have the L2, L4. The L2 and L4 nerves that come off the spine influence the femoral nerves. This affects the quadriceps strength and the front of the knee function. So remember, those quads are in the front. Just tap your thigh above your knee. L2, L4. Now L5 influences the popliteus muscle, which we have found to be a major player with knee pain. Popliteus is kind of locks the knee in extension when it's not working properly. And there's a very simple test to illustrate that. It's actually a very good soft tissue therapy to reestablish normal spinal communication with the popliteus muscle. And what happens here is the L5, will help support the back of your knee from a stability standpoint. So even minor lumbar dysfunction can alter the knee mechanics. So that's what I'm saying. We got to look elsewhere. Now, let's look at another overlooked area with knee degeneration. Inflammation affects pain sensitivity and tissue recovery. Inflammation is not what you're feeling, but what it's doing is pretty systemic, and it makes it more difficult for the muscles, the ligaments, the tendons, the cartilage to function properly. So if you think of inflammation as fire, you can't build a house while it's on fire. And then basically you have to think about, you're eating too much processed food. What else, are you doing wrong that you could be doing better to help with inflammation, okay? Internal inflammation can and does amplify knee pain. Some of its sources of metabolic and lifestyle factors like poor diet, not enough exercise. Number 3 on the overlooked area for accelerated knee degeneration is blood sugar fluctuations, increase inflammatory signaling. So these things called cytokines, and I won't get into cytokines, but they're helpful in the short term, bad in the long term. And what happens is the increase in inflammatory signaling sensitizes joint and surrounding areas. So a little bit of pain, allodynia was another fancy term where you feel pain, much more pain than you're supposed to feel because the tissue is oversensitized because of the inflammation, which comes about from blood sugar fluctuations, okay? So pain perception worsens or can worsen without a new injury because of problems with blood sugar. So I doubt somebody's going to be checking your blood sugar when you have a knee problem. They're just going to say, here, let's do these gel shots, or let's do surgery, or just do physical therapy. And if that works, then you don't need to be listening to the rest of this podcast now, do you? Let's look at overlooked area number 4, diet inflammation. Highly processed foods increase inflammatory load. That's cytokines, good in the short term, bad in the long term. Poor nutrient intake slows tissue repair. Okay, again, it's the hands down, the diet inflammation is bad. You can't repair your body with a poor diet. So the diet plays a big role if you want to avoid knee replacement. If you want to if you want to go from stage 3 to 2 to 1, stage 4, have at it. What's going to happen is going to happen. So the knee is let's consider the weight and joint loading. The knee is a force amplifying joint. For every pound of body weight, the knee experiences 3 to 5 pounds of force during walking in stairs. Okay? So 10 pounds of body weight, 30 to 50 pounds of extra force per step. You think about that for a while, okay? So weight is a problem, as with many, the whole body. I mean, if you're way overweight, that's not going to help your knees. And is a knee replacement going to help you if you're way overweight? Yeah, listen, it's knee replacements are a godsend when you need them. The question is, are you doing everything to help your own body? So just consider that the weight being a pretty big issue. So let's go over why localized knee treatment often fails. You're going to miss the key contributors that could be causing it, like lumbar spine dysfunction, we already went over, blood sugar imbalance, chronic inflammation, excess mechanical load, and lifestyle factors. These type of drivers can continue stressing the joint. It explains why steroid injections also don't last, or for that matter, why the gel shots don't last, even though they just come back another 2-3 months, we'll do a few more shots before the insurance company says no. All right, so let's take a whole system perspective, addressing the spine, nerves, blood sugar, inflammation, weight, lifestyle, and the knee together, okay? So what we get by just taking a look at on a more global scale, okay, let's reduce the total inflammatory burden, less cytokine activity, less inflammation. Can we decrease the mechanical stress in the knee joint, and can we support better long-term outcomes by addressing those other health issues, like, again, spine, the nerves, blood sugar, inflammation, weight, lifestyle, and the knee itself. So think about it. A whole perspective supports better long-term outcomes. I think that makes sense. All right, now let's go over one of the most amazing things is we have decompression. Now, we're going to first start with back decompression because the nerves are compressed in the lower back. How are we going to fix that? I'm going to tell you how we're going to fix it. Spinal decompression will take pressure off the nerve roots in your lower back like you can't believe, okay? And it is not just a chiropractor, Stanford, Darien, Norwalk, Canaan. I can tell you hands down that it's a great addition to do spinal decompression if those nerves are involved. But that's what I do differently. I look for those nerves, see if they're involved. And if they are, well, we're going to take care of that by doing spinal decompression with a highly specialized unit called the Back on Track. But we're here to talk about knees. So guess what? We're going to dive into our next thing, which is called the Knee on Track. The Knee on Track is, I'm going to tell you something. As far as I know, I'm the only practitioner in the state of Connecticut with the Knee on Track. And what happens is the Knee on Track is a game changer in many ways. What it does is it's targeted knee decompression, it reduces joint compression, and supports circulation and movement. And in doing so, it also helps you produce more synovial fluid, which is that lubricant, similar like the lubricant like your oil is for your car. Well, synovial fluid is like that. The gentle traction or the decompression of the joint stimulates the synovial sites to produce more synovial fluid. So, excuse me, it makes for a very, very good way of treating a bad knee. Now, I'm going to touch on a couple more issues here. The one being another therapy we use is like PEMF therapy, which is supports cellular signaling and circulation, helps reduce inflammation, and makes your stress response a little more effective. Laser supports cellular energy and tissue recovery. It helps calm local inflammation. So, and this is stuff that has been out there for a while. But are you using all these different modalities? And that's what we do differently here. That's why I think the 6-week knee reset is a valuable tool if you're looking to avoid it. So the next thing I want to touch on is shockwave therapy. Shockwave therapy is a phenomenal way to help the soft tissue break down what they call adhesions, okay? These adhesions are muscles that change the fascia. So think of all the muscles that are associated with the knee, a lot of them. By using the shockwave therapy, or ESWT, another name for it, we can help break up the adhesions and allow for better circulation and stimulate localized circulation at the knee joint. Now, one of the other things we do typically in our office, and again, we have many different therapies for knees. So it's not just one particular therapy, but a patient comes in, when they go through the 6-week knee reset. It's an intensive program. I give you that. Also, too, as I'm going to tell you something, Medicare does not cover it. Never have, never will. But we do another technique called blood flow restriction. Okay, blood flow restriction is when we have you on a vibratory plate and we block the venous return of blood flow. So there's a blood deficit. Now, it's not painful. And what will happen is when we do blood flow restriction, when we take these bands off of the, we put it right by the thigh, high up on your leg. And what will happen is we take the bands off after doing the vibratory plate. There's a rush of blood that comes in, and that blood brings healing properties and helps take away some of the inflammation. So that's a huge game changer into itself. And I've just outlined shockwave, laser, PEMF, vibratory plate, spinal decompression, knee on track, knee decompression. Now I'm going to hit on something else. Knowing how to make sure the muscles are working, identifying the muscles that are not working properly in your leg is a process we call trigenics. Okay? Trigenics is a game changer in that it helps limit pain by stimulating two different types of nerve cells. One's a Golgi tendon organ, and one is a muscle spindle cell. And these things have direct input to the spinal cord. And when the connection is proper from the cell itself to the spinal cord, you're gonna have less pain. Okay, when it's working properly, that connection breaks, you're gonna have pain. So the body's way of that. Your brain is not able to see that particular joint. And a lot of times we're gonna hit on one particular muscle. One particular muscle is with the popliteus, which is behind your knee. 90+% of the doctors who take a look at your knee are going to say, okay, it's a knee problem. Like I said, there's a little therapy, a little Advil, gel shots, surgery, PT, all the other stuff. They're not going to look at the popliteus. The popliteus is swollen. They're going to probably call it mistakenly as a Baker's cyst because the back of your knee is going to be puffy. Oh, you have a Baker's cyst. That's all. And they're going to, here's your diagnosis. Not telling you what to do. But that muscle there will prevent your knee from locking in extension, which adds more compression to the joint. So think about this. When you're standing up straight and your knees are locked out, you can stand there for hours. Bend your knees a little bit, you're not going to be able to stand there for a couple hours. It puts more tension onto the meniscus and the cartilage in the meniscus. So I think I've hit on a lot of different points. Do I think it's a 6-week knee reset's a great program? Yes. As far as I know, we're the only people who offer this in Connecticut because I created it myself. Am I a genius? No, but I do work pretty hard, and I like to make sure people get the results that they come in and pay for. So a couple takeaways, okay? Knee pain is often the result of multiple interacting factors. Finding out which they are and addressing them will have a greater result, okay? The knee may be a symptom, but it's not the only source of pain. What happens is a broader view like I've suggested here with the 6-week knee reset supports a better long-term result, okay? It really does. So if you have any questions, I'm Dr. Brian McKay, not just a chiropractor because we do knees. We do a lot of different things here. But what I want to stress to you is that this program, the 6-week knee reset, is a solid program if you want to avoid knee surgery, knee replacement, or if you already had these things, a way out of it, and hopefully get you back to a better quality life. I could be reached 203-656-3636, 203-656-3636. If you like, I'm more than happy. Call up and we'll send you out. Give my staff your email and your name and address, and we'll send you a copy of the 6-week knee reset protocol. All right. Now, will you be able to do it at home? No, it won't be, unfortunately, but it'll give you a little more information. It better more educate you on the better decision you can make. Because, perhaps it's not the right decision for you. I don't know. But listen, I want to thank you for listening. I hope you found it informative. Dr. Brian McKay, not just a chiropractor. My practice is Core Health Darien. Been doing it for a number of years. I love to help people. Take care.